Okay, just a little bit of the background I have. We've been trained by, I have a mentor. He's a molecular biologist. And by education, I'm a dentist. And an additional studies I made is integrative medicine, the combination of pharmaceutical and the found out that the one of the best natural medicine, okay, is located the biotech company located in Japan. One of it's AFC. Okay, another thing we have biotech manufacturers from Europe, Eastern Europe as well, and they have the we call this functional food that actually penetrates at the genome level or the DNA level. Okay, so let's begin. Okay, we have the product here, SOP Subarashi, Utsukushhii, and Hikari. Some of you probably, pronouncing this will be a mouthful, but these are Japanese nomenclature or names that they put it in here. Okay, so these are life-changing products from AFC, and I would like to congratulate the members in AFC for actually making this kind of product. And I will show you why it is the best, one of the best products. If I tell you this is the best products, that is very biased of me, but this is one of the best. Okay, I just found the best three functional food. Okay, the human can actually consume and reverse its unfavorable health condition. And one of it is AFC. Okay, the other one is already closed. Okay, these and then the disclaimer: these statements made in this slides have not been evaluated by the Food and Drug Administration. These statements and the products of this company are not intended to diagnose, treat, cure, or prevent any disease. Okay, SOP Subarashi. Okay, the previous SOP Subarashi that we have the triple peptide. Okay, we have the marine placenta, the salmon ovary peptide, which is a standalone, a supplier. It's a group of supplier and a biotech manufacturer that they already have their own, what do you call this, their own clinical studies. We have sardine peptide. We have fruit flow, which is a vegetable-based peptide. We have the sweetener, which is stevia. We will see this at the back of the label, okay, or the box, in which this is the one indicated. Unless otherwise, there have been some additional. We have pearl barley yogurt powder. We have vitamin C and glutathione. Okay, these are the triple peptides. However, SOP Subarashi has added some. Okay, we have the hexapeptide. We have the tuna heart peptide, and I saw some, based on research, I saw some fishermen who's actually getting the tuna heart and eating it raw. Okay, and there's a reason why. We have the salmon caviar peptide. And we have the salmon anserine or anserin peptide. These are the additional peptides. Okay, just a small information here. I've discovered. Okay, the ingredients inside SOP Subarashi. These are in a nutshell. Okay, what do you mean by that? For example, the placenta, the salmon ovary, the peptide. We are talking about peptide. What are peptide? These are what do you call this? These are combinations of amino acids. We have 20 amino acid in additional 2 that actually is participating in the production of the genome. That's additional 2. Okay, but the most basic information, the 9 essentials and the others. Okay, 11 essential amino acids. Okay, in the future, I'm gonna discuss that why the peptide is very important, because peptide in a combination of amino acids, a combination of these molecules, can initiate an action in the body. Okay, and I was amazed when I saw the tuna heart peptide, and there are more than 14 peptides within that peptides, okay, and within that material. First of all, the marine placenta, the salmon ovary peptide, okay, as you can see here, this product are extracted and purified from salmon ovary. Okay, we will see this. You will see this, that there is an encasing here, and that is the actual ovary. Okay, and some of the covering or the membrane of that ovary, and even the salmon raw, its casing or its membrane is also indicated or used by the company, okay, the supplier for this, giving it to AFC. And they have actually, have clinical studies like cell activation, okay, using the skin and or the dermal fibroblasts, which is in the skin elasticity, and the type 1 collagen production. Okay, collagen is very important because everywhere, the eyes, the bones, the matrix structure of our body is collagen. Okay, this is the best source of collagen. Okay, and that they have also what do you call this? Have some human testing for even for 2 weeks, and regarding to closure of the pores or shrinking of the pores of the skin, wrinkles, okay, and the stains. They call it stains, but it is actually aging spots. Okay, they have the ability. Okay, this one, the marine placenta, has the ability to enhance the skin in terms of its function. Another thing, the sardine peptide, okay, the sardine peptide, this is not medicine, but is actually causing the anti-hypertensive effect, okay. For the doctors, this is the ACE inhibitor or inhibiting activity, okay, or ACE1 activity, or which is actually, it's not medicine, but it's actually part of the benefits of taking a sardine peptide, okay, and even helping our glucose, okay, glucose tolerance and glucose metabolism, okay, and it also helps the same thing with fruit flow. They have the ACE enzyme inhibitor, which is also an anti-hypertensive effect, okay, and anti-inflammatory as well, which is, when you say anti-inflammatory, okay, the inflammation there, and even the actual pain is actually attenuated, or what you call this, it's actually reduced. Okay, it also helps the heart in terms of this peptides that we have. Inside of this marine placenta, the sardine peptide and the fruit flow, we have the blueprint of the nucleic acid, the basic. Okay, are you aware that one cell, okay, is actually equivalent to 0.4 billion pieces of nucleic acid? It's the blueprint of life, and this is actual raw material that we use for repairing at the DNA level. And then if it is nucleic acid that is combined, okay, it will combine, okay, three of it will combine, it will form the amino acid, the basic building blocks of the body. And the material, the peptides, okay, and the peptides, it's a, if it is a conglomeration of peptides, we will create a protein. By the way, I just want you to know that there is a Nobel Prize Award 2 years ago, and this Nobel Prize Award is actually the folding of proteins. For the doctors, you will understand this. The folding of proteins is actually creating peptides. And when you create peptides, there is a specific action. And that specific action can target whatever anomaly, whatever health condition, unfavorable health condition that is in the body. So the Nobel Prize Award winner used AI technology in folding of the proteins. So in short, they have already answered, okay, some curative effect, okay, using proteins as the medium to target ailing parts of the body. However, the problem here is it's still on its development stage, but they have actually, they have already success. However, if we're gonna use the ancient techniques, okay, if you saw the video of the SOP Subarashi before, that the fisherman is actually using the salmon ovary, okay, or the raw, and using it as part of medicine. And they have actually, because of trial and error, they have already found out that this is actually a life-giving food, which is in the oceans of Japan. Okay, so these are ancient food, and even science has not yet been, cannot decipher it yet of the action of these peptides that's in it. That's why we only extract that peptide. Okay, so another thing here, aside from the nucleic acid, we have the elastin, okay, and function is to nourish the skin elasticity, and prevent from sagging, is especially with collagen. And the highest form of collagen is in the AFC Subarashi. They have actually, tap the actual trigger to produce collagen in the body. We have also hyaluronic acid, which is the cushioning of the joints, and chondroitin, which is actually blocking enzyme that breaks the cartilage, especially for those who have rheumatoid arthritis. Okay, we go to the next slide. Now, these are the pearl barley yogurt, vitamin C. These are added, nutrition, okay? And even the yogurt powder is actually binding it. And, vitamin C is added to preserve the glutathione, to preserve the other antioxidant inside, and to preserve the, peptides inside, okay? And all of this is actually in the SOP Subarashi, the new version, which is the, the hexapeptide. Okay, continue. Tuna heart peptide, okay? The tuna heart peptide is actually, number one, and the source of, it's the heart cardiac arterial bulbs of a tuna. And actually, aside from the tuna peptide, there are enormous amount of peptide. There are peptide. In the future, we're going to discuss this, the PKK, the YEGGT, so forth and so on, all of this alphabet inside. Okay, they are amino acid in combination. Okay, so these are actually highly absorbed by the body. Okay, and actually, one of the function here is to reduce the formation of the peroxides. Hydrogen peroxide, the one we use for cleaning, for laundry. Okay, these are actually produced by the body, okay, in excess. This peroxide is actually beneficial for killing the viruses and bacteria. However, because of the lifestyle that we have, the environment that we are in, the peroxide increases, so the stress increases. I'm sorry, stress increases, so the peroxide, not only the peroxide, but also the hypochlorite. When you say hypochlorite, these are also cleaning agents, okay? Chemical use for bleach. And the body is also producing that in terms of induced stress. Another thing is the anti-inflammatory here, and also to regulate the gut. As you can see in the picture, these are also helping the cardiovascular system. This peptide targets the strengthening of the heart, okay? And another thing is the uric acid management. And these are a person with a high uric acid management, and this is also part of their patents, okay? The discovery of their patents in the tuna heart peptide. And another thing is used for skincare, okay? Tuna heart peptide sometimes is used in cosmetics, and because of its anti-aging and protective properties, and also its power to reverse. They call it anti-aging, but I call it reverse aging. Based on the experience of AFC, people using it really reverses their aging process, I mean, okay? Uric acid management, and then, the skin, as well as the skin. Another thing, the salmon caviar is also an anti-inflammatory. Together, they are actually what you call the synergistic in action, strengthening each other's ingredients. And the salmon caviar peptide increases the hydration, especially for the wrinkled area of the skin, especially in the face, okay, on the continents. Okay, and these are actually part of the what you call this, part of the upgrade of the SOP Subarashi. Another thing, pain management. Okay, for those people who are not able to climb upstairs, okay, or inclined areas, or hiking or something like, or running. Okay, those impacts on the joints and the heels and the balls of the feet, you can feel the pain because the cushioning is already out, or there is a excess formation of uric acid. Are you aware that uric acid is formed if there is a lot of carbohydrate sweets that you're eating? That's just a thing here. Salmon answering peptide, okay. This is located in the muscles, okay, of salmon. Why? It is an anti-fatigue properties. Imagine salmon swimming. You saw the river, there is, they're swimming against the flow. They're not fatigued. Why? Because of this salmon answering peptide, okay. And this is actually part of the ingredients that we have here: anti-fatigue and recovery. Almost all of the products of AFC, the Hikari, okay, their specific recovery here: recovery from exercise endurance, and recovery from athletes exhaustion and muscle pains, okay. Anti-fatigue. Another thing is the cognitive and brain health, okay, and because of this, is actually increasing the cerebral blood flow, and also the preserve verbal episodic memory in elderlies, okay. And if they're speaking, I have an 84-year-old mother, and sometimes her word is all fillers. You cannot understand it. That's why you need to listen carefully. That's why, people who are in, 60 years old, 50, 70 years old and above should always take this kind of functional food. Okay. Another thing, antioxidant, anti-inflammatory. Another thing, they have triple peptides. Okay, the salmon answering peptide, the tuna heart peptide, and the what do you call this? The salmon. What do you call this? Oh, I'm sorry. The salmon. Yep. The salmon caviar peptide. Another thing is this one is can also help regulate blood glucose, improve kidney functions, and reduce what you call this the hyperlipidemia or accumulation of clogs in the artery. Why? Because of its omega-3, okay, and it's actually dissolving this kind of clogs in our arteries. Okay, so the triple peptide is now the hexapeptide with the tuna heart peptide, salmon caviar peptide, and anserin peptide. Okay, so the possible benefits for this one, for the heart, protection of the heart, normalize blood pressure because it has an anti-hypertensive properties, no, and the blood vessel, the pancreas, helps improve glucose tolerance and insulin sensitivity. Kidneys, prevent kidney injury damage, improve the filtration system of the kidney. The cells, the cell membrane cohesion. Are you aware that our SOP Subarashi, the Utsukushhii, and has a measurement, a molecule measurement between 400 to 800 Daltons, okay, which penetrates the cell, which actually, diffuses into the cell and feeds all the chromosomes, feeds the mitochondria, feeds all the organelles inside the cells that make it rejuvenated, and makes it what you call this producing healthy cells or producing daughter cells. Okay, another thing, it is also a stem cell therapy. What do I mean by that? Okay, oral therapy, when you say stem cell therapy, I don't believe that. But in this case, the stem cell therapy comes from the producing and replenishing the bone marrow stem cell to assist in DNA repair and cell repair. It is actually, when you're going to take this kind of product, especially all of this peptide, it will initiate the bone marrow stem cell production. And that stem cell production will feed all the, will feed the stem cell and will produce the, what do you call this, the necessary cells needed by the body, like the blood cell is only 120 days, platelets 7 days. We have neutrophils, the white blood cell that kills viruses and bacteria. And that is actually, that's only gonna live for 7 days, and you need that. And this is the stem cell therapy that we need. Okay. Aside from going to the doctors and getting the fats from your belly or your omentum, and they're gonna actually process that and they're gonna re-inject it to you. That's a different stem cell therapy. Okay, the brain. Okay, for the brain, the skin. All right, wait one moment. Yeah, the skin, the bones, the muscles. When you're taking this kind of product, it's actually the peptides and the proteins and the polypeptides and oligopeptides. They are there to protect us from sarcopenia. What is sarcopenia? Helps prevent muscle deterioration during old age. Are you aware that our body is actually the muscle is atrophied or depleted, okay, or shrinks 10% of it every year. That's why when you see the the previous bodybuilder, when you see them in their prime, you see that they have a high musculature body. But when they age, they turn 18, 70, you will see it's all drooped down, and everything is actually they seems to look normal in terms as a senior citizen. Okay, another thing here is the joints, and because it has the material, okay, the material, the hyaluronic acid, the elastin, the collagen, the chondroitin, all of this, there is a potential. In mainstream medicine, there is no cure for this, but in the eyes of a naturopath, okay, this may actually help the formation of new cartilages. Okay, that's my opinion only. DNA repair. What do you mean DNA repair? DNA repair, the repair system, I'm going to show you later. The DNA repair system that actually is happening in the body when you're taking this kind of functional food. Okay, we have 8 patents. Before we have 4, and it's enclosed in this box. You can see there we have additional new patents: cell rejuvenation, anti-aging effect, and for liver health, and even the reduction or the restoration of the proper uric acid production. Okay, so before in SOP Subarashi, we have this one. This is my actual interpretation of that. The heart, the anti-thrombotic agent or anti-platelet aggregation, or no clogging of the blood, and the what do you call this? And the bloodstream. Anti-hypertensive effect. Why? Not only have a angiotensin enzyme inhibitory here, or ACE inhibitory in our blood circulation, or putting down the or regulating the blood pressure. It has also the ability to produce nitric oxide, a precursor, okay, from the other ingredient that we have in our SOP Subarashi, Utsukushhii, and Hikari. Are you aware that if you're gonna take that, the instruction in the box, at the back of the box, is say you drink it, you put 200 ml of water, and then stir it and drink it. Some of us use it for oral, in terms of taking it sublingually, or just eating it, lingering in the mouth, so that the commensal bacteria and the ingredients of SOP Subarashi, Utsukushhii, or Hikari, in this case SOP Subarashi, will actually be incorporated with the commensal bacteria of the mouth. When you swallow it, it will produce a metabolites. I'm sorry for the word, but it's just a chemical, a natural chemical that produces nitric oxide and makes your blood vessel dilate or relax. When your blood vessels dilate, it relaxes, and then the blood will flow. And there is no clumping of the red blood cell. There's no clumping of the platelets, and everything is a smooth flow. Okay, that's why the other patents improve peripheral blood flow. Okay, and they have tested it in such a way. They have their own testing, and then cell repair, cell regeneration, and production, because you are nourishing the cell, giving it all the potential, the electrical potential of the cell, giving all the nourishment of the cell. And that is the reason why SOP Subarashi is actually very successful functional food. The additional here is anti-aging effect, cell rejuvenation, the activation of the cell. Okay, kind. The activation of the cell, and actually, as you can see here, there is a composition for inhibiting liver function, the deterioration. Sorry for that wrong spelling. All right. All right. I do apologize for that. As you can see here, the top liver is the normal liver. The second is the cirrhosis, and the third is the hepatocarcinomic cell or cancer of the liver. Okay. All right. Another thing, reducing uric acid and gout. Okay, as you can see there. Just to give you a picture of what is gout, that is a perfect picture that you cannot close your hands anymore. Okay, so that is the the 8th SOP Subarashi, the new SOP Subarashi patents. All right, so the function, okay, the bodily system, okay, you took it. It will be absorbed in the small intestine, not in the large intestine, okay? And there is a villi, okay, the one that absorbs it. Are you aware that the villi only survives within 3 to 5 days, and then it needs to be replenished? So that's why some of us is constipated, or we have diarrhea because of that. Okay, that's why we need to replenish all of this, especially when we discuss Utsukushhii. However, I don't have the time for that. Okay, the Utsukushhii. And this is the microvilli cells, which is surrounded by those, finger-like protrusion there. And then we have the cell, and the cell is the nucleus. The nucleus is inside. There is it houses the chromosomes. The chromosomes, you will see there the defects. That's why we have hypertensive patients. We have diabetic patients. We have rheumatoid arthritic patients. We have autism, person with autism, people with Down syndrome, and all of that, people with cancer. It's affected by the chromosomes. We have 23 from our mothers and 23 from our fathers. Together, there are 46 chromosomes. These chromosomes are actually, if you add 47, now you have Down syndrome. But if you have 45 chromosomes, you will not survive. You will not live. Okay, so these are the where the damages happen because of what we do, the lifestyle that we have, the lack of sleep, the lot of carbohydrates and sweets that we have. Okay, the stress that we are in. Okay, that's how chromosomes are damaged. And when the chromosomes are damaged, when you go to a repair shop, okay, you want to repair. Here in our end, we do have our cells being repaired, and we go to a technician. We call it a technician or a computer. They open the box. The same thing. They open the DNA. And the DNA is the one being fed by our SOP Subarashi, Utsukushhii, and Hikari. Okay, in the middle, you will see there that there is the nucleic acid. As I mentioned a while ago, these 4 are in constant, they have a sequence. That's why we are different from each other. Okay, and someone will tell, oh, the Asian looks the same. I assure you, we don't look the same. Okay, because of this, probably there is a hint of, the same likeness, but we are not the same. We are not all the same. Even the Asian style, the Americans are all the same. They look the same, in our mind. Why? Because they have a very nice and long, not long, what do you call that? We have a nice structure of a nose, okay? And that's why, not all of them is the same. Probably there are a a lot, Elvis is different, but there are a lot of Elvis look-alike, but they're not all the same. But probably they sound the same when they sing. Well, I'm just saying that all of this has a sequence, and one cell is equivalent to 3.2 billion of this adenine, cytosine, thymine, and guanine. Okay, where will you get that? Number one, into your diet. However, based on the diet, you can only absorb the protein there within the the body's happy if you up to 30%, 10 to 30%. However, okay, that's why we have the AFC. The AFC has a Dalton of 400 to 600 that penetrate the cell and feeds and nourish the cell and do its function and uphold the structure of the cell. Okay, upholding the function and structure of the cell. We're not talking about medicine. We're talking about nourishment. We're talking about raw materials. Okay, so this one, okay, so when you take SOP Subarashi Utsukushhii, okay, either of the two or three, depends. And when you have unfavorable health condition, you may want to take more of this one, okay? And probably you have a question how to take it, how many times to take it, okay? And another thing here, if you take this, all of this, these are the raw material. They will produce enzyme that will, the enzyme, the peptides, the protein, okay? It will produce, it will initiate the production of this nucleic acid and will make a repair system, and it will make a healthy chromosome. It may even reverse the unfavorable health condition, as you will see in the testimonials that we have. Okay, it will have a healthy cells, and that cells, okay, will have a healthy tissue, and that tissues, okay, will have a healthy organ like the liver. Okay, are you aware that the liver has 500 functions? Just having a fatty liver, either non-alcoholic or alcoholic, the 500 function is disrupted. That's why we are sick. That's why we need this kind of functional food. And all of this is fed with SOP Subarashi, Utsukushhii, Hikari. All of this will have a healthy DNA, healthy cells, healthy organ, and that's the best version of you. All right? Now let's go to the testimonials. Okay, Alfredo will help me with this one also. Okay, these are the testimonials, okay, or anecdotal reports. Okay, you will see the difference, ladies and gentlemen. Okay, these are for beautification, pits and pores. Okay, 14 sachets each of SOP Subarashi. We are talking about the old SOP Subarashi. Now we have even more powerful peptides that actually help the skin and the heart. She reverses their age for 10 years. Okay. Look at her. Okay. You will see the difference. Okay. Well, one of the reverse aging situation here, if you're gonna take this kind of functional food, the evidence here is from a gray hair or white hair. It will go back, the keratin will be added, and then it will, your hair will be younger, and also your skin. Okay. Another thing is the autoimmunity. This one is vitiligo. I don't know if the spelling is right, but it's a process. It's but in 2024, he's already looking handsome. Okay, vitiligo disappeared and healed 90% after consuming. Okay, psoriasis. Okay, skin autoimmune issue or disease. Okay, you consume 2 boxes. All right, so you will see here also. Okay, you will see here also another psoriasis. Okay, from this one to a clear one, a child. Okay, and this one is one of my favorite. They said that this kind of diabetic issue will not be reversed. Okay, as you will see here. I was astonished. You will see here, ladies and gentlemen. You will see. Sorry for the graphical, implication of this, but you'll see the awareness that if you're gonna take this, and you will see that there is improvement from this kind of diabetic gangrene. This one is actually a bahasa. I'm gonna put it some English. It's a wet wound. They call it wet wound, okay, or raw wound. Okay, on the leg shown in the photo. After finishing 3 boxes of SOP Subarashi with a dose of 2 by 1, and finally the wound on the man started to dry up and gradually heal. And there's also a disclaimer: the benefits felt here will certainly not be the same for everyone, but it will differ for each consumer. Okay. Another thing here. Wow. Okay. Okay. This is very graphic. You will see that you can only see the tendons. Okay. You can identify the tendons there because it's already open. And after 1 package of Subarashi no Utsukushhii, there you go. Here in our end is already candidate for amputation, but in their case, they are tenacious in terms of naturally healing themselves and using. You, you will see here the bones is already, steam, but they opt not to do surgery. Are you seeing this? Okay. Sugar is 577, and lung problems, and which is possible tuberculosis. Finishing 6 packages, and okay, so no more amputation. This one is cancer. Please be mindful. This is the ulcerating large open wound, and this is a you will see that after taking 3 days after a product intake, 7 days and 11 days. Okay, the wound is initiated closure. Okay, pardon my picture. Before, there is a big tumor on the head, and then after using the product, it already disappeared. Okay, no hair will grow if there is still a lesion on that head, and that's why you will see there's no more lesion. Okay, the child has a what do you call this, a future because of this one. Mouth tumor. Okay, after taking 1 box of Utsukushhii, some of them is actually not that cash ready, but they have they actually doing the best to the product. It's a gift to ourselves. Buying this product is a gift to ourselves. Okay, especially if you're the person who's doing the breadwinning. All right. Goiter suffered from nasopharyngeal cancer. Okay. From ICU to ICU later. Okay. That herpes simplex simplex complex on a face. Okay, and actually the doctor said it will damage the eyes because it's actually at the back of the eye. And then she took the Utsukushhii and SOP Subarashi, and then the face, she had added the product from AFC. They call it Sensei Saru. It's a serum. Okay, and helped her recover in 3 months. This one, the lady is actually cleaning the toilet and put some, cleaning agent, a harsh cleaning agent, and spewed out on her face, and causes wounds and scars. However, after taking the product, okay, 2 sachets of Utsukushhii and a day regularly up to 1.5 months, and consume 3 boxes of Utsukushhii. Hair, okay, hair loss. My suggestion is you can dilute it in distilled water and then apply it directly to the scalp if you want. That's how we Asians do it. We use it in every way we can. We put it topically. We put it in our eyes, in our what parts. Suffer from hormonal imbalance. Okay, consume 2 sachets. For those people who's actually a long-term medicated for hydrocortisone or steroids, you may want to use this kind of product to alleviate those imbalanced hormones because of the peptides inside our product. Utsukushhii is the best for people or teenagers with severe acne flare-ups. Okay, acne flare-ups, 14 days. Okay, and this one was, tumor-proof, almost covered her face. Use Utsukushhii and SOP Subarashi. Results. Okay, we actually yep. As you can see here, they used the old version of SOP Subarashi. A stroke patient, recovers after 2 sachets, morning, noon, and night. SOP Subarashi a day. He's now recovered nearly 90% from stroke. Amazing.
Dari kondisi Bang John sendiri sudah 95% perubahannya.
Ya, begitu dari saya terkena stroke 1, 2, 3, 4.
Speeding cells so that cells can be energized. That's why stroke patients can be helped by our product. Okay, Parkinson's testimonial, Mr. Fang from CPA 1. Okay, and he talked well. No, now after 10 days of using AFC products. Parkinson's, this is the best because that's what we gave when I'm previously doing my clinic, a naturopathic clinic, not the dental clinic, the naturopathic clinic. And in 1 month, a different product, almost the same component. almost the same, but not as superior as the AFC. She already walked, okay, but she didn't return because the product is expensive. Okay, scarce. Okay. You will look beautiful again when you're taking the product. Okay. This one is for the Hikari. Hikari is for the eyes, brain, and skin. Okay, and after taking, she already saw up to 5 doctors. Okay, and 7 or up to 8 psychiatrists because she has anxiety. Are you aware that the Utsukushhii and SOP Subarashi can actually reverse psychiatric issues just taking by taking? And the answer there is very simple because we nourish the gut. The gut and the brain has a connection. The connection is the vagus nerve. Okay, if the vagus nerve is disrupted, okay, or if your tummy has a parasite, the parasite can take over your decision. That's why sometimes you are craving for sweets and salty and something, something you wouldn't do, okay, or you were not gonna like to eat, but it's actually dictating you. That's why there's a communication between the gut and the brain, and the parasite is overriding that. Okay, and I only ate 14 or took 14 sachet of hickory, and my eyes were not, drooping anymore. My mood became cheerful, and skin color become normal and beautiful. Okay, so this is Joyce from KL. Okay, this one is wound healing. Okay, you will see the tagging of the skin is first. Yeah, there you go. Or thyroid problem. And there you go. Okay, before dressing, you will see there that, they also use the Sensei Salute. And after that, it's already well, we saw this already. Okay, and I'm sorry about this. This one is necrotizing fasciitis, a bacteria eating flesh. Okay, the doctor said that we need to amputate that, but the person started to take Utsukushhii, started in 1 a.m. and the doctor will have 6 a.m. to amputate it, but the person took it every hour after hour. Okay, and after 5 hours, the doctor saw that there was an improvement, and he increased it, and that's why the person recovered. Okay, this person is a health practitioner as well. Okay, and the verse is not. Oh yeah, after 3 months of consuming one of Subarashi and Utsukushhii daily, the health issue was recovered. He looked younger. Okay, and he also has a nasopharyngeal cancer, clogged 5 arteries. Okay. Sometimes the practitioner, the health practitioner, is the most stubborn person you will ever meet, because because we know how to how it works and how to hack the system. That's why we are the most stubborn. Probably I'm speaking for myself. Probably he's not stubborn, but he is just hickory. This one is for the hickory. You will see there that the operation was canceled. Okay, and because of the corneal infection. Okay, you will see that. Are you still there? Psoriasis testimonials, okay, you will see that there's a reversal of this one. We regulated the cells, the immune cells, so that it won't attack the skin cells anymore. This one is wound healing. Okay, no scars for 2 months, as if there's no scars. Recovery system is faster. Okay, if you like dogs, cats, okay, this pet has a tumor, and the pet owner feed it with Utsukushhii and SOP Subarashi. Okay, and the tumor got smaller. Hair growth after 12 boxes. Okay, in August 25. From March of 2024 of last year. Okay. All right. Okay. As you can see, these are the lectures I made for the AFC group, and probably we're gonna touch it in the future. But as of now, I'm only able to talk about the new Subarashi. I hope you appreciated it, and okay, and if you have questions, I'm able to try to answer it as close as possible. All right. Any questions? You can type your questions, or you can ask it on the microphone. Don't be shy. Come on. You have questions?
If no one's going to say anything, I will say something for my brother and his sister are on here. I've spoken with you when we used to do this more often, but some time ago. But she has cancer now. I would like her for herself to ask specifically for her. Denise, can you talk? Would you ask your question? Hopefully they're listening.
There's a question in chat too.
Okay.
Okay. Question. Okay. Let me just. Okay. Good morning. Okay. About lymphoma, right? Is that the question?
That's it. Yes.
Okay. Yeah, regarding this is actually good. There is no right or wrong intake of Subarashi. This is not medicine. When you take it, there is a possibility of toxicity of if it is a medicine. Now, if it is you're gonna take this with person with this kind of health condition. Okay, I call this probably a catastrophic health situation. You may want to take the regimen here. Okay, the regimen. I'm gonna share the. Okay, gonna share the slide again. Can you see the recommendation on the screen?
Yes.
Okay, so let me go back. The recommendation of MIMS is actually if you only have Subarashi. Okay, Subarashi is in MIMS Indonesia, which means this is actually used by health practitioners, especially doctors or naturopathic or traditional Chinese medicine in Indonesia. They can use this 2 sachets daily. Okay, these are tonics. If you only have Subarashi, or if you only have Utsukushhii, this will be the choice. Okay. Now, I don't have Hikari yet. Hikari is the same. Hikari is specific for the eyes, the brain, and the skin. Okay. Now, if the person has this kind of issue, the unfavorable health issue that he or she is right now, what we're gonna do is recommend use. This is the minimum amount recommended use: 1 sachet of each SOP Subarashi Utsukushhii before any meal, at least 10 minutes. Okay, under the tongue. Okay, swivel it over the mouth, over the over the cheeks. Okay, as long as it's actually absorbed. Okay, and the rest of it you can swallow it. You can drink a shot of water, okay, to rinse the mouth. You can do that. That's the minimum I suggest for a person with that kind of situation. Especially if there is a budget constraint, there is funds that are needed to buy this product. That's why the product is not inexpensive, and you need at least of this if the person has lymphoma. So can we guarantee that next question? Can we guarantee that that person will recover from this kind of health situation? Medicine doesn't guarantee anything. You just need to take. But this one, the SOP Subarashi Utsukushhii, there you have an edge. I can't guarantee also. Okay, we cannot say you're gonna heal, you're gonna recover. No, you need a lot of material, raw material, to support the normal cells, to build the normal cells, to strengthen the normal cells, to initiate the healing process. That's why you need this kind of functional food. And you need to shun from food that will actually hurt you. What are the food that are going to hurt you? Would you like to know? You're quiet. Let me answer that.
Absolutely, yes.
Anything that is sugar, refined flour, anything that will actually, you eat meat, that's okay. Okay, but refrain from sugar. You can only eat what is recommended for example. You're from the States, right? Your states, you don't eat rice like Asians do. You eat bread, right?
Well,
That is
some of us try to be gluten free.
okay. When you say gluten free, what is the carbohydrate here in the Philippines? I'm sorry, here in our part of the world, gluten free is not known to us. Okay, but in the States, because you are overdosed by gluten, you have gluten intolerance. So what carbohydrates you eat? Potatoes?
Well, in the States, we have gluten free bread. Sometimes it's tapioca root, rice.
Okay, if you're gonna eat that, you eat it the regular way. But refrain from donuts, ice cream, pastries, cakes. Refrain from that if you have this kind of issue.
Mm-hmm.
Okay. Only children can eat that. However, children, started with that kind of diet when they become teenagers. Probably they have, a pre-diabetic, in the pre-diabetic zone. So this is the minimum requirement, for a person. That requirement, just enough functional food to trigger the healing process of the body, so the body can help it. And based on what we have experienced, what I have experienced, some of them is reverse. Again, this is different from person to person. But there is hope in terms of you getting the best, one of the best functional food available right now.
Can I ask
hope
you
I
a
answered.
question?
Okay, so go ahead.
Okay. Do you have
Can
any
I close
results
this?
for people that have strokes, not strokes, central sleep apnea and also epilepsy?
The best product for
Yes.
epilepsy is
Alfredo,
Hikari.
Albert, I
Yep.
used to have sleep apnea for 27 years. No more. No more sleep apnea.
Yeah, but this is specific. There's obstructive and there's central sleep apnea. I'm concerned about central sleep apnea where you don't always take a breath at night when you're sleeping.
That's me. That's me for 27 years. No more. Gone.
Very good.
Question: Why? Why? What is the product doing? That's why there's no more sleep apnea for Ray. Am I saying your name right, Ray?
But
Roy.
also what was the regimen? What combinations and frequency of AFC products were you taking?
17 months of taking the products nonstop. It not just do that, but even my beard is already 1/3 black again.
Wow.
My waist used to be 54. Now it's 34, like back in high school. We have to get reports to prove it. You need to go get blood work to show it. So even my leaky valve on my heart for years is gone without surgery. And usually they say when you have a leaky valve, you have to get surgery sooner or later. That's gone. The word SOP, diabetes, is real, what they're saying in Indonesia. So this test that we've been having, and including so many cancer patients today, we're going to be showing and bringing these folks to tell them their own testimony in the USA. So yes, in the last 17 months, the effect of this thing is reversing almost every issue, but we have to deal with it and taking the product consistently and persistently or it to be effective. So that's a lot of the testimony. I have folks with different kind of cancers that will be able to come in and talk when we start doing testimony on that. Okay.
I'm still
Ray, nice
still
Ray. Thank
curious
you.
to know what combinations and frequency of products. Did you take 2 SOP and 2 Utsukushhii and 1 Hikari? What is the combination for those 17 months, sir?
In the 17 months, it's about averaging to make sure that 3 times a day I have at least 1, and all 3 is very effective. So in the beginning, we do not have Hikari, but in what we have is actually just the Utsukushhii and Subarashi. But because I don't have any issue with the word cancer or tumor that I know of, so I take only 1 Utsukushhii daily, and I took 2 Subarashi daily because the issues was the heart, the kidney, and because my kidney function went from 30 to 55 in just 60 days of taking the product. But when the Hikari came in, I mean, we got so many verification right now of what the Hikari is doing and how effective, just like myself. Before I can read captions and things like that, I have to wear my glasses all the time. But I can read all these captions on TV without even looking. There's no blurry. Those are gone. So yes, is my CPAP usable? Well, I always carry, but I never use it in the last 4 months. No need. So that central apnea is very real. And of course, like myself, I went through 2 quadruple bypass. I have 5 major back surgeries. I was told in 2018, go home pretty much and die. You only got 30 to 45 days left of your life. Well, and I remember, and my wife will remember, that my wife was brought into the room to let her know that I'll be going into the hospital at least every other week for the rest of my life. Wrong. That doctor is wrong. I haven't been in. And as a matter of fact, today, not just that I'm walking, but I'm living proof that I can go jogging too. And I can do almost everything that I used to do back in my 20s. So yes, it's we need to share the world, and we are going to do this here in the USA because we want to. I know we got a lot of questions, but we're pretty much limited in time. So we could address a lot of other questions, and we're going to be doing a lot of testimonials in the US real soon. So at the beginning of the year, we will have a lot of this testimony from in the US, not just from what we're hearing from Indonesia. Because when I first heard about this in Indonesia, I thought it were all AI. Maybe it's not real. Maybe it's makeup. It is very real. Albert, are you pretty much done?
Yep, just answering questions from
Albert, I do have one question because I know the product has been enhanced, and so it's better.
Yep.
And
Yes, sir.
so since it's better, does it change the recommended dosage because the product's better, and what's the difference?
Okay. The difference is actually we don't call this we actually don't restrain ourselves in I don't know how to put this in word. The SOP Subarashi, before they're taking it probably if a person has an unfavorable health condition, okay, they're gonna take it 3 times 3, okay, or 3 SOP Subarashi, okay, and that will be 3 times a day. Okay, you may want to double check this and reduce it to just 2 times a day, but the Utsukushhii will still remain. Why Utsukushhii? Utsukushhii is actually a very powerful probiotic, prebiotic, and postbiotic inside. Okay, and actually, this is actually you're going to use this to coordinate. The good bacteria will coordinate with the immune system's cells or immune cells in the body, and that will actually help in terms of people with a oncogenic issues. Or I'm just careful with my words. Okay, so this has been recorded. By the way, if this is in US, please do not post this to any social media platform, because if we don't have yet FDA approval and they saw this, okay, and our intentions is good, to them, what we're saying is already claimed. We may have difficulty on approving our papers in terms of the FDA if there's no FDA papers yet. That's why this is for personal use only, and it should not be posted on, again, any social media platform.
Correct.
Subsubashi,
Hello, I have a question.
From 3 to 1, 3 to 2, and Utsukushhii, if that's 3, you still need to use as a 3, and just proportionate to the usage or the regimen that you're using right now. Yes, sir. You have a question.
Hello, sir. Yes, I do have a question. I'm sorry, I'm driving right now. What countries are you shipping to already? And do you have any certifications such as halal or GMP or any of those types of certifications for international affairs?
Alfredo is the main guy who's going to answer you with that.
Yeah, definitely we have those certificates that we from AFC. Remember, AFC is the biggest pharmaceutical company in Japan. They are GMP certified, and they have all the licenses to ship it to any parts of the world. We've been shipping out to countries like even in Europe, and even to the third developing countries. We can send it, no problem. But the only problems that we had when we ship big box, yeah. So we can ship anywhere around the world on a self-consumption a package. That means the most we can send is 6 boxes out to a country. Yeah, 6 boxes. That means a sapphire package. Yeah, that's the reason why when we wanted to ship to Philippines is quite strict, but we can send it for self-consumption basis.
Right, right.
2 boxes to 6 boxes. That's all. All right.
But Alfredo, it's 12 to the US.
Yes, 12 for US. I'm talking about the other parts of the world. Yeah.
That's right.
Even Australia, we sent before, you can ship 12 to 16 boxes in the one big
Right.
carton. Yeah.
Australia is the worst. It's the strictest.
Australia and New Zealand. Yeah.
Yep.
Even we send to China, it's not any issue. Yeah.
Okay. Are there any more questions? Otherwise, we have a guy who's gonna. Is he still around? Tang Vincent, can we invite him?
Yeah.
This is a live
Yeah,
testimony.
I'm around.
Okay, great. So, ladies and gentlemen, I'd just like to welcome Vincent, who is used to have a kidney issue. Probably you can introduce yourself, Vincent.
Yeah, I'm Vincent from Malaysia, Kuala Lumpur. So actually, I got kidney. I do kidney dialysis 1 year before. Until now, it's already 1 year plus already lah. So then for the kidney dialysis patient, normally before that I do 3 times a week for the kidney dialysis. Now after taking this product for 2 months, now until now it's already 5 months lah. After taking 2 months, I already do dialysis for 2 times only for a week lah. So then a lot of improvement lah on that. So then another thing is normal. If let's say dialysis patient, normally few things they cannot do one lah. If normal before that after dialysis you cannot pass urine, you cannot drink a lot of water. So then your kidney function is already less, only about 3 to 5% only. 3% for my EGFR is dropped to 3%. My creatinine level is up to 1,003 at that time lah, before I eat this product lah. But after I eat this product, I take this product, after 5 weeks my creatinine is dropped to 1,000 point. That means already dropped 300. Then EGFR go up to 6 already lah, from 3 up to 6 lah. So then now I do 2 times dialysis per week, Monday and Friday only lah. So then you can see that the energy level, the strength for me is very different from the person who are doing dialysis and person who didn't take this product lah. So I take this product for 5 months already. Now coming to the 6 months, then my second, I can say that my second blood test this coming January, then will be more improved lah. I think I see that lah. Because when I take this product already, so much different lah. I can say that the energy level, I can drink a lot of water, because normally dialysis patients cannot drink a lot of water ma. So then the blood circulation is not good, the function is not working, because if you are doing dialysis. But after taking this product, so then everything go back to the normal. my kidney function, my energy level, everything go back to normal, I can say that. So then only thing that I still need to do dialysis because the cell regeneration in our kidney is not so fast yet. Because I can say that if after 3 months my creatinine level drop 300 point, then another thing is EGFR go up to 6 from 3 up to 6 within 3 months then 6 months later will go up another figure lah. So then I know that slowly until maybe take 1 year's time, then I will totally off for that dialysis because I got the confidence because this product already let me feel that the kidney function go back to normal. This is my sharing from my own experience lah. Then in the kidney dialysis patient in my center there, out of 11 people, 9 people also taking this product. They got same problem like me, but they take this product and then also slowly they improve it lah. So then for this one is my own personal. Another one is my talk about the this stroke patient. I got one experience in stroke patient. One of the senior guy, 77 years old, got stroke. Then they got kidney problem, got heart problem, so many problem. So then after they taking this product for 5 days, he can walk up and using the walker to start walking, Until now, it's already 2 months. He already can take bath himself, do all the things himself already. So before that, is totally lying down in the bed because that there is a stroke patient. So then these are 2 testimony lah. Got a lot lah. Actually, we got a lot of testimony regarding the cancer patient, stroke patient, all these things in Malaysia.
Thank you for the testimonial. It's
Yeah.
been-
Okay.
You look younger.
So then this is a sharing lah. Thank you.
You're welcome.
Thank you, Vincent.
Yep.
Okay. All right. Albert, I think we are done with the product presentation and the testimonies now. Thank you very much, Albert. Thank you, Vincent. Now we'd like to welcome